Hi, and welcome to the Health 2.0 conference here in Las Vegas. We have our next guest joining us. If you'd like to introduce yourself and your organization for everyone.
Sure. My name is Vivek Mahendra. I am the managing partner of an organization called Vivikta Advisory. Its predominant focus is enterprise architecture advisory. Now, it's important that we somewhere explain what
Yes,
EA would
yeah.
mean. It's a discipline which translates uh, organization strategy into an implementation or implementable set of rules and approaches. So that's what we do as an organization. Simplistically, somebody says, I want to access the third world with affordable healthcare, then we will translate that into process steps, organization design, approach strategy, and so on and so forth, all the way up to implementation. So that's the role that we play as an
Okay.
entity.
Okay. Wonderful. And um, networking wise, how has things been going so far at the conference for you?
It's been interesting. This is my second one, not here in the US.
Oh,
Our
okay.
earlier one was in Dubai.
Dubai. Okay. Are you based
So,
in Dubai
no, I'm
or?
based in India.
Oh, okay,
Yeah,
based in India.
but
Okay.
I realize obviously there's a more diverse set of audience that we see here,
Yes, yes.
which allows me to maybe get a wider perspective than I normally would,
Yes.
maybe in some other place. So I think that's the interesting part here.
Yeah, absolutely. And if someone wanted to follow in your footsteps, what do you recommend? What steps they go through?
Yeah, we are in a 60-second TikTok world, right? But unfortunately,
That's true.
but unfortunately, my discipline requires
Yeah.
details.
Yes, yes.
So the
And
whole
dedication.
Yeah, and dedication. So, but the most important part is the devil is in the detail. And my request is whoever intends to pursue anything in their life successfully, at least should look at things in details.
Wonderful, wonderful. And you did receive the Health 2.0 Conference Award. How did you feel about receiving that recognition?
Uh, see, so for us, what is important is that we continue to pursue doing what we intend to do. But only thing is, a recognition is only a fillip. It's like a push in your thing. So go ahead and do more.
Yeah.
So I think that's definitely what it is. It just helps you get up, motivate yourself once again, and keep on doing what you're doing better.
Wonderful, wonderful. And how do have you, let's read this one. How have your solutions ebbed accessibility and affordability in healthcare?
So, see, the whole principle around which I have approached the whole healthcare ecosystem is
Yes.
from a facet of making affordable healthcare taken to the masses. You need to also understand and contextualize from where I come from. I come from India. There's significantly disproportionate ratio in terms of clinicians to patients. And India has another issue that uh, a lot of things get bumped up to tertiary care very, very quickly. Tertiary care means that be more expense per patient.
Yeah.
So the whole intent was to see how do we alleviate that situation. What we do is that we tend to start working together with the public sector, the government, and what we call as the primary health centers, and see how we reach across digital-led solutions at that level. Because the intent there is to see, can I reach across to the rural most entity and be able to start looking at provisioning screening services and whatever that is needed to prevent an episode to happen. So basically, if an episode happens, then you're already in a state where to be in a hospital. The
Yeah.
intent is to prevent that from happening. And if you're able to maybe even do a 1% impact there, you would have maybe led to millions of dollars of saving, but more importantly,
That's true.
saved that many more lives.
Yeah.
I think that's an
It's like
important
domino.
construct. Yeah, correct. So domino
Domino
effect.
effect. Yeah.
So I think that's what we are trying to do. We have been working very closely with primary healthcare centers. With some of my clients, we've kind of gone across and implemented approach first level screening approaches at common service centers and so on. So the whole intent to see how do we therefore capture and do prevention at this layer before this gets bumped into maybe a tertiary case.
Wonderful. And how can people contact you? Because I know you're based in India. Do you like telehealth as well, or do you also do? Is it mainly in person?
So see, for me, my practice has no boundary per se. I'm an enterprise
Okay.
architect.
Okay.
So I work here with clients in the US. I work with clients in
Okay.
the Europe.
Okay. You do.
I work in whichever location that is supposed to be done. you can actually go to my website and you can get in touch with me.
What's the website
It is
called?
Vivikta, Vivikta.net. You can go to the website or you can go
Okay.
to my LinkedIn and I'll be accessible at the point.
And is your LinkedIn
Vivek Mahendra.
Mahendra?
Yeah.
Okay. Perfect. Thank you so much, Vivek.
Thanks so much.
Yeah.